Good day, I'm Paul Nathaniel de los Santos, your clinic nurse for UP Depot. This is UP Depot Clinic Orientation for face-to-face classes. Entrance to the campus premises. Screening and detection will be done at all entrances, school and building. Security personnel on duty are assigned to conduct mandatory symptoms and temperature checks of all those physically reporting to class and collecting their accomplished health declaration record before they are allowed to enter the building. Ensure that only those who do not exhibit any COVID-19 related symptoms are allowed to enter the building. Contain a positive or confirmed case of COVID-19. All individuals detected with COVID-19 related symptoms will have to stay in the holding area at the entrances. Students, faculty, staff with a body temperature of 37.5 degrees Celsius and above will be sent to the holding area and allowed there to stay for 5 to 10 minutes. If their temperature normalizes, they will be allowed to go inside the campus or building, otherwise they will be sent home. Students who were not allowed to go inside the campus must inform their instructors. Daily submission of health declaration record must be done through the QR code available at the entrances. There will also be available forms with the guard. In case a COVID-19 suspect case has entered the campus, the health liaison officer will bring them to the isolation room for further assessment. The decontamination of the places they have been will be initiated. The school will abide by the lockdown protocols imposed by the IATF and/or the LGU. In the absence of the health liaison officer, an authorized person designated by the health liaison officer will take the patient to the isolation room. Symptoms being monitored. COVID-19 related symptoms are the following: fever, temperature greater or equals to 37.8 degrees Celsius, sore throat, cough, colds, shortness of breath, diarrhea, loss of taste, loss of smell, body pains, and headaches. Just a reminder, if you feel sick, please avoid going to the campus so outbreaks can be prevented from transpiring at the UP depth. This will greatly help in preventing the spread of the disease. While at UP depth, the use of well-fitted cloth mask or a medical mask is required. The following are recommended. Cloth masks should be made of at least 2 layers of cotton. Medical masks should be non-woven nylon within an aluminum nose bridge. Students should follow the seating arrangement given by the instructor. The maximum capacity of the venue should be observed. Observe proper hand hygiene. Wash your hands frequently or use hand sanitizer or alcohol. Physical distancing of at least 1 meter should be observed in indoor spaces. While walking around the campus, always stay 1.5 meters away from other people. When eating or drinking, students should keep a physical distance of 2 meters from other people. Observe respiratory etiquette. When coughing or sneezing, direct your face away from other people, even if wearing a mask, and put a 2 meter distance between you and the other person if possible. If a student develops symptoms while at campus, the faculty or class representative shall inform the health liaison officer for initial assessment. The student will be sent to the isolation room for evaluation. The student must wear a tight-fitting mask. The student will be sent home and will be instructed to get tested. If the student is unable to go home due to extreme symptoms, the protocol and transfer will be followed. Here are some pictures of the isolation room located at the academic building, first floor. Emergency transfer protocols. In cases where a faculty, student, staff members who tested positive for COVID-19 or has severe symptoms and needs to be transported to an isolation facility, home, or hospital, but has no personal vehicle, the UP Dep Clinic will transport the COVID-19 suspect using the unit's dedicated van. Referral system protocols. If a faculty, student, staff members tested positive for COVID-19 but is asymptomatic or has mild symptoms, they will be referred to their dedicated RHU. On the other hand, those exhibiting moderate to severe symptoms will be directed to a tertiary hospital, Rafael Lasatin Memorial Medical Center, or RLMMC, will be our hospital of choice. Here's an overview of the hospital's location from the campus. Quarantine and isolation protocols. The school will adhere to the current isolation and quarantine protocols implemented by the IATF. For quarantine, if you are a symptomatic close contact, if you are fully vaccinated, there's no need for quarantine unless you develop symptoms, which makes you a suspect. If you are partially vaccinated or unvaccinated, at least 14 days from exposure. For isolation, if you are a symptomatic confirmed case, if you are fully vaccinated, at least 7 days from positive test. If you are partially vaccinated or unvaccinated, at least 10 days from positive test. If you are symptomatic, suspect, probable, or confirmed case with mild symptoms. If you are fully vaccinated, at least 7 days from onset of symptoms. If you are partially vaccinated or unvaccinated, at least 10 days from onset of symptoms. If you are with moderate symptoms, regardless of vaccination status, at least 10 days from the onset of symptoms. If you are with severe and critical symptoms, regardless of vaccination status, at least 21 days from onset of symptoms. If you are severely immunocompromised, regardless of vaccination status, at least 21 days from the onset of symptoms, with negative repeat RT-PCR. Protocols when there is on-site exposure. Quarantine is no longer recommended for people exposed to COVID-19 except in high-risk situation as per DOH IATF guidelines. Classes will proceed after the suspected COVID-19 patient is brought to the isolation room and disinfection procedure has been done. Classes will shift to online class while waiting for the room to be disinfected. Students are encouraged to do the following at home. Wear a mask to prevent exposure to other people at your homes. Monitor yourself. Preference for counting exposure days. Day 0 is the day of your exposure to a person with COVID-19. Day 1 is your first full day after exposure. Persons can still develop COVID-19 up to 10 days after exposure. Be cautious while the 10 days is being completed. During the 10 days, wear a mask at all times to prevent exposing others to you, especially those with comorbidities and the elderly. Avoid going to places where you need to take off your mask. During the 10 days, students can continue going to class as long as they wear a mask and have no symptoms. Protocols when there is on-site exposure after isolation. If a student underwent isolation due to having COVID-19 or suspected of having COVID-19, the student is required to submit any of the following: medical clearance from the clinic. Please coordinate with the health liaison officer for students. Quarantine completion certificate from the barangay. This should be presented to the clinic. Physical distancing protocols. The school will implement the 1.5 social distancing suggested by the IATF and CHED. For seating arrangement, UPDEP will observe the 1 meter social distancing advised by the CMC. Disinfection protocols. The UPDEP campus has disinfection protocols in place following DOH guidelines. For those who are interested on the procedure, that's DOH Administrative Order Number 2020-0157. Face-to-face classes will shift to online while the rooms or venues are being disinfected until the building administrator and clinic clears them. The health liaison officer shall inform the faculty in charge of the affected classrooms. Outside the campus, face-to-face participant should follow the precautionary measure and minimum health and safety protocols on and off campus. All are encouraged to avoid situations and activities known to increase the risk of COVID-19 transmission. Everyone is advised to limit travel to only essential ones. In case of unavoidable personal travels during the course of face-to-face classes or activities, the concerned participant must properly inform the FIC or faculty in charge and ensure that the latest IATF quarantine and isolation protocols are followed, if applicable. Updates on COVID-19 protocols, announcement or information regarding health and safety protocols will be given through orientations, social media sites of UPDEP, Facebook and website, through the Student Relations Officer, and emails. Crisis Management Committee or CMC. For contact information, for UPDEP CMC, that's Assistant Professor Angela D. Corion, our chairperson for UP Depot CMC. For email, that's adcorion@up.edu.ph. For UP Depot Medical Clinic, Paul Nathaniel G. De Los Santos, Health Liaison Officer for UP Depot CMC. For email, that's clinic.eppo.upd@up.edu.ph. For UP-DEP address, that's Ramon Magsaysay Avenue, Extension, Clark Freeport Zone, Mabalacat City, zip code 2010, Pampanga. For UP-DEP trunk line, that's 045-499-9970. CMC members, for our chairperson, that's Assistant Professor Angela D. Carion. Our co-chairperson, Dr. Pinelo Pinalo, Medical Specialist. Health Liaison Officer, Paul Nathaniel De Los Santos. For information dissemination, Assistant Professor Arielu Margaret A. Aguilar, Chief Information Officer. For Graduate Program Cluster, Assistant Professor Edelbert G. Galang. For Business Management Cluster, Assistant Professor Eunice G. Felix. For Applied Psychology Cluster, Assistant Professor Brian Q. Engay. For Business Economics Cluster, Dr. Patrick C. De Leon. For Administrative Offices, Ms. Carl Ann M. Sanguyu. For Student Liaison Officer, Assistant Professor Melissa P. Calica, Student Relations Officer. For Building Administrator, Mr. Merck Sayan Sontan. For Student Class Representative, to be announced per section. Thank you for watching this video. Please accomplish the evaluation form, which can be accessed through this link.